Hello, this is Dr. Aasim Maldar. I am a consulting endocrinologist at PD Hinduja Hospital, Mahim, Mumbai. Today, let us discuss a newly diagnosed case of type 2 diabetes with a high baseline HbA1c level. Mr. AB, 45 years old, newly diagnosed with type 2 diabetes, visited the clinic 6 months back with multiple risk factors, including obesity, hypertension, hyperlipidemia. He was initiated with metformin with advice for lifestyle and diet modifications. Recently, he visited again as a part of routine checkup. His laboratory workup showed the following reports: HbA1c of 8.5%, a calculated eGFR of 80, LDL cholesterol of 80 mg per deciliter, HDL cholesterol of 38 mg per deciliter, a total cholesterol of 174 milligrams per deciliter with a triglyceride level of 200 milligram per deciliter. The medications which he was on were metformin 1000 milligrams twice a day, lisinopril 40 milligrams in the morning, metoprolol extended release 100 milligrams in the morning, atorvastatin 40 milligrams at night, and aspirin 75 milligrams at night. Physical examination revealed a BMI of 31 kg per meter square, blood pressure of 120 by 70 millimeters of mercury with a heart rate of 78 beats per minute. Evidence indicates that early intervention and achievement of glycemic control reduces the long-term risk of microvascular and macrovascular complications in type 2 diabetes. UKPDS demonstrated a legacy effect of early intensive therapy because the difference in the cardiovascular event rate 10 years post-trial was apparent even though no difference in HbA1c levels between the intensive and conventional therapy. When metformin is not suitable, and empagliflozin or linagliptin, that is the drugs from the SGLT2 inhibitors class or DPP4 inhibitor class, is being considered as an alternative to first-line treatment. Initial combination therapy may be considered to achieve target more quickly, particularly in patients with high baseline HbA1c levels. Early combination therapy in type 2 diabetes makes clinical sense for several reasons. First, a meta-analysis demonstrated that early use of combination therapy significantly increases the likelihood of achieving the glycemic target of HbA1c less than 7% compared with metformin monotherapy alone. For patients with HbA1c more than 1.5% above their goal, ADA and EASD guidelines both recommend first-line treatment with a combination therapy, and an SGLT2 inhibitor may be used as first post-metformin treatment, especially in patients with established cardiovascular disease, congestive heart failure, or a chronic kidney disease. Empagliflozin and linagliptin combination with complementary mechanisms and pleiotropic benefits may be suitable option across a range of patients, including those with established ASCVD or high risk for coronary vascular disease, established heart failure, or CKD due to tolerability of the combination, in addition to the potential benefits of empagliflozin on cardiovascular and renal outcomes. There are no increased risk of heart failure with either agent. According to the study, early achievement of HbA1c goal less than 7% with this combination could reach the target level 12 weeks earlier as compared to monotherapy. HbA1c decrements by empalina combination, 25 milligrams of empagliflozin with 5 milligrams of linagliptin, has demonstrated 1.8% reduction of HbA1c from baseline when it was more than 8.5% at 24 weeks in metformin treated group as compared to metformin treated group. The benefits on glycemic control were maintained at week 52 in metformin treated groups, and a higher percentage of patients achieving HbA1c less than 7% were reported from combinations. The combination offers a suitable component in strategy to achieve HbA1c without increased risk of hypoglycemia and weight gain, with improvement in overall lipid profile as well. A reduction in the incidence of genital infections, which are seen with SGLT2 inhibitors, has been reported when a DPP4 inhibitor is added, perhaps because there is a better glucose control although other possible mechanisms may still remain and they are yet to be investigated. In summary, empagliflozin plus linagliptin in combination provides robust HbA1c reduction, 2.4 times higher odds of patient reaching the goal HbA1c of less than 7% compared to monotherapy agents with a low hypoglycemic risk. Thank you.